San Diego Made, San Diego Proud. I'm Carrie Lane. Welcome. We are celebrating businesses that have helped define San Diego as America's finest city. Today, we have the solution for knee joint pain. And if you or someone you know suffers from one of these problems, well, help is on the way. ShapeMatch technology is helping keep people pain-free and active. And here to tell us more is Dr. Erik Stark and one of his many success stories, Dan Marker. Good morning to the both of you.
Good morning.
We'll get to you in just a second. Dr. Stark, I want to talk to you about your patients that you see because they tend to be more active and younger than maybe in the past.
Yeah, I think traditionally total knee patients were thought of as older patients, and now we're seeing it more with a younger patient population, a more active patient population than in the past.
All right, so now patients that are receiving this, so Stryker's custom fit knee with ShapeMatch technology is actually a really great solution for all of this. So let's talk a little bit about that and how it works.
Well, the ShapeMatch technology is our ability to create custom guides for an individual patient's knee that helps us during the surgery. Hopefully perform a better, more precise total knee replacement.
Okay, so now this is a knee, and basically these tools allow you to be more precise, right?
Correct.
So let's kind of show a little bit about how this works.
Well, this would be a total knee after it's performed, but to help us get to that, we have to actually make certain bone cuts to help put the knee in place.
Right.
And these guides here will help us make the cuts so that so we can put the knee in the proper alignment.
So now the patient has an MRI, and then it's put into a computer.
Right, and then a 3D rendering of the knee is made. The 3D rendering will have a preoperative and a postoperative look with the knee replacement in place on the computer. I can review that. Based on my review, these guides are then created, brought to surgery, sterile, and used during the surgery to help with the procedure. It can make the procedure more efficient, hopefully a quicker procedure, potentially less blood loss, and other advantages.
Easier for you, you said, right? The patient has the hard work. And Dan, you underwent this in about August, correct?
Yeah.
So why did you decide to go ahead with the surgery, and what have the results been like for you?
Well, I had a bad surgery about 20 years ago, and it progressively got worse and worse, and there really weren't any options. I talked to Erik, and we decided, he talked about the ShapeMatch, and we went ahead and had it done, and it's been a great outcome.
And I'm sure recovery, obviously a tough road with anything like that, but how do you feel now?
Oh, I feel great.
Yeah?
I wish I'd have done it 15 years ago.
Are you able to be more active?
Yeah, in fact, I'm probably the knee itself is in better shape than 20 years ago.
Wow.
So back surfing, doing jiu-jitsu.
Good for you.
It's changed my life.
Oh, that's awesome. So many people sit there and they fear this, but doctor, when should people consider a possible knee replacement surgery?
Well, I think when a patient has a pain in their knee where it's becoming debilitating, they're severely uncomfortable, they can't do the activities they want to do anymore, they should at least come in to be evaluated. They might not be a candidate for a total knee, but that's where the process begins.
All right, so Dan, tell the folks at home why you would recommend this. Any advice for them? I mean, you've been there, you've been in pain.
Yeah, I would say if you're in that kind of pain, get it done, because I'd put it off probably too long. I didn't realize, I wasn't sleeping very good at night just because my knee hurt so bad. Now I look back, there's no pain, get it done.
You're a perfect example of why this is a good thing.
Yes.
All right, well, thank you so much. Your job's a little easier now and you have happy patients. It's a win-win, right?
Yeah, he had the hard work.
Thank you so much for joining us, the both of you
Gary.
today. And thanks to Stryker's custom fit knee with ShapeMatch technology, joint knee pain is a lot easier and doesn't keep you sidelined from life anymore. So thank you both so much. And that's a look at this week's San Diego Made, San Diego Proud.